Good afternoon. I think this first question is for you, Doctor. It is from Tom Mooney of the Providence Journal. How many of the total virus deaths in Rhode Island are now associated with nursing homes? And he goes on to ask, and why are officials no longer identifying which homes had the latest fatalities?
So we have approximately 55 deaths associated with nursing homes at this time. As we are collecting the information about unfortunate deaths and nursing homes, it takes time to make sure that we are associating it with the correct facility. What I can share is for the unfortunate deaths reported today, 4 of them were associated with Oak Hill, 2 were associated with Golden Crest, 1 was associated with Elmhurst, and 1 associated with Oakland Grove. So we can continue to provide that type of information as we receive it.
Thank you, Doctor. Next question is for the Governor from Steve Alquist of Uprise RI. If the Governor does not have the power to raise the wages for essential frontline workers, shouldn't the General Assembly take this up? People are risking their lives and the lives of their families. Why not convene the General Assembly?
Yeah, thank you. So I do agree with you that those low-wage essential workers, healthcare workers, grocery store clerks, et cetera, who have to continue to go to work are they're working hard under difficult circumstances and potentially exposing themselves to the virus. The best way to handle that, I believe, is for the federal government to provide them with a wage subsidy. And I'm working with our federal delegation in order to make that happen. I just recently today, I'm advocating to the Trump administration and Treasury Secretary that they make that a priority. In the same way that the Congress has provided $600 a week extra in unemployment insurance, the same should be done to enhance the wages of people who have to go to work. You know, we're helping out folks who've lost their jobs, which is a great thing. We also need to help out people who are still working. And so I don't think it's as simple as passing a Rhode Island state law to tell employers, all of whom are struggling themselves, that they have to increase wages. What has to happen is the federal government should subsidize wages to properly compensate low-wage folks who have to go to work under these tough conditions. And I remain hopeful that that's going to happen, and I'm going to keep fighting for that.
Brian Crandall from NBC 10 asks, can you clarify quarantining for people who live in Rhode Island but may do their grocery shopping just over the line in Massachusetts? Do they need to quarantine after going over the state line for a short time?
Yeah, the answer is yes. And again, these questions, I appreciate the question, but right now until May 8th, we are imposing the strictest interpretation of these rules, and we shouldn't be asking ourselves, how do I push the limits? How do I get out from under the rules? Could I just break the rules a little bit? We should be saying to ourselves, how can I try harder to obey the rules? We have a chance right now. The social distancing measures that we've taken, which I grant you are extreme, are really beginning to work. And so if you can just hang in there a little bit longer, it's until May 8th, I am hopeful that they will continue to work until then, and then we can get us to a place sooner that we can start relaxing these. So short answer, Brian, is yes. I know it's a pain, it's an inconvenience. We're trying to contain folks in Rhode Island, and so if you have to do your grocery shopping in Massachusetts, then you're quarantined.
Next question is for Dr. Alexander Scott. You did mention a little bit of this in your remarks, but Ryan Belmore of What's Up Newport is asking if you can clarify why the Department of Health isn't sharing a number for recovered and why we haven't seen data based on race, ethnicity, or zip code.
We are working towards having the number for recovered readily available. It is a calculation that has to occur. I shared earlier all of the people who have been discharged from the hospitals. We know the total number of cases that we have. That total number has to be subtracted from people who are still in the hospital and people who have unfortunately passed away. The number that remains would be those who recovered after 2 weeks of time. And so 2 weeks ago, when we had numbers, the total was a lot less than what we have now. So we're waiting till we have enough numbers to be able to share that calculation on a regular basis so that it's something that people can respond to. But we know overall that it's the total number of cases minus the people currently hospitalized and minus those who have unfortunately passed away with that 2-week time period that it takes for someone to really get through an illness and recover. The race ethnicity data is something that we have also been working diligently on. Every state has needed to come up with creative ways to be able to compile this information. And I really want to acknowledge tremendous work that armies of people are doing with our data at the Department of Health, and that's the lead for across state government. Some of the preliminary race data and ethnicity data that we have is of the cases that we've collected information on, those who are Latino from any race are about 10% of the cases. Those who are African American, non-Hispanic, are about 3%. Those who are Caucasian, non-Hispanic, are about 10.9%. And the remaining races, non-Hispanic, are about 1.4%. A majority of the cases we are still working through creative ways to getting the race ethnicity data, but we know regardless, the numbers that we're seeing nationally and what we are aware of here emphasize the importance of addressing the social, economic, and environmental factors that are contributing to why you are seeing these gaps among various racial and ethnic groups, as well as other populations, low income, those who are immigrants. We need to really focus on those communities. The Health Equity Zones infrastructure is one that's designed to help us be able to do that, and those are the types of strategies that we are looking to advance so that we address it regardless of what this data shows.
Thank you. Governor, the next question is from Jim Hummel of the Hummel Report. He says, we have heard that tenants right now are being protected from evictions, but what about renters who have landlords that don't provide what they're supposed to, such as hot water? Who do the tenants go to for relief when the courts are closed?
Yeah. So first of all, landlords shouldn't be doing that. So if you are, I'm asking you to stop it. It's not right to take advantage of people as we're going through this crisis. Secondly, if you're a tenant and that's happening to you, call me. Call the governor's office, send an email to the governor's office, and we'll get on it and help you. I will say the courts are open for emergency or necessary matters. They're not open for routine matters. So depending on the circumstances, if it's something that's really an emergency, the courts would be open and they would handle it.
Next question is for Director Alexander Scott from Tony Mendez of Pother 102.1 FM. What is not being documented in this coronavirus crisis that you wish was being tracked or documented?
That's an interesting question. There's a ton of information that's flowing. And being able to understand the root causes that are contributing to some of the race, ethnicity data differences that I shared earlier, and being able to really respond to the needs of our vulnerable population is a data point that we are working to continue to unpack and better use to help us inform our response so that we can continue to do a better job making sure across the board that we are equitably responding to everyone's needs within this pandemic.
Next question is for the governor from John DePietro. It's been reported that you will be part of a joint news conference later today with governors from New York, New Jersey, Connecticut, Pennsylvania, and Delaware regarding a coordinated response for a reopening plan. Any thoughts to a separate effort with Governor Baker and Governor Lamont?
Yes. In fact, probably most important is with Governor Baker, since we we in Massachusetts share a number of very large employers. Many people commute between the states every day to go to work. So Charlie and I have been in contact, our teams were in contact, in addition to this effort today. I will say there is no formula around how to reopen the economy. None of us has ever lived through this before. So I don't know that we'll all do it exactly the same way, but these sorts of discussions are incredibly helpful for us to share information and share data as we together get our place to some sense of best practices around how to do this. But I'm definitely in close contact with Governor Lamont and Governor Baker.
Michael Bilo of Motif Magazine asks, Rhode Island is working with Salesforce on contact tracing. A lot of rapid work is ongoing to make a smartphone app that pings nearby devices via Bluetooth while protecting privacy using DP3T or other protocols, with Google and Apple collaborating. Is Rhode Island involved in any of this research? Yes, we are. In fact, we reached out to Google over a month ago to ask them if they would help us build these sorts of apps. The solution that we ultimately roll out will, first of all, it will be incremental. So we'll roll out a version 1, which is has kind of minimum requirements, and then a version 2, which will have maybe a slick interface, and everything can be done on your phone, and then maybe we'll roll out something else with more advanced functionality, as you describe. The way we're doing this is we're not really building anything on our own. We're patching together a variety of off-the-shelf software and just trying to customize it for Rhode Island and make it as easy to use for the consumer as possible. Steve Klamkin of WPRO Radio says, you mentioned testing as one of 10 teams working on the coronavirus response. What are the other 9? This is a quiz, Steve. So I have one working on procuring PPE. We have another one working on our hospitals and the hospital surge programs. I have another working on the stimulus and how will we allocate properly the stimulus funds in the best interest of Rhode Islanders. I have one on data, one on modeling, one on contact tracing, the question we just had, one on quarantine and isolation, and I think that might be it. Tech, a tech team, what we just talked about. So a tech team. And this week, I'm going to give an update on each one. Tanya Signori of the Rhode Island Echo asks, the numbers of both hospitalizations and positive cases is a cumulative number. Some individuals have recovered and others have been discharged from the hospital, hence these are not the current numbers. Can the public start having more current numbers? Can this be done on a once or twice a month basis?
We are absolutely giving current numbers and absolute data. Each day when we are talking about current hospitalization numbers, it is not the cumulative number. We are actually giving who is currently in the hospital. So we're doing better than once or twice a month. We're doing it every day. Currently, there are 197 people who are in the hospital.
And our last question today is from Nancy Thomas of RI News Today. Massachusetts is using the Battelle mask sterilization process with 4 trailers operating around the clock at a facility south of Boston. Could Rhode Island partner with them to provide sterilization for our masks? And are there any Rhode Island, Massachusetts partnerships happening?
Absolutely, Nancy, we are ahead of you with that. We've already engaged with Massachusetts and absolutely are taking advantage of the sterilization process. We need all tools in our toolbox to help us be able to extend the personal protective equipment that we know is so critical for our healthcare workers to be able to have. Thank you.
Thank you, Doctor. Take care.
I forgot to say the new normal. That's the 10th work stream. So we have a big team working on all the details required to get everybody back to work, industry by industry. So thank you.